everyone. I'm Chitra Panjabi. I'm the Vice President of Membership at the National Organization for Women. So glad to be here today and on this panel. Overcoming the isms is probably one of my favorite topics to talk about. And that's probably for a number of different reasons, but primarily in part what it is that we do at the National Organization for Women. We really do look at things in an intersectional way. Women are of different races, they're of different ages, they're of different gender and sexual identities. And one of the things that we do really talk about, especially since the founding of the organization, is how those things come together and sort of compound what we see as sexism in our society today. One of the things that we really sort of try and do it now, which as I'm learning more about the Grey Panthers, I see that you're doing that too, is the intersectionality, what it means to have various parts of your identity commingled with each other and how you can't tear those apart to really understand how oppression affects all of us. And for women, that can really be a couple of different ways. The three things that I want to touch upon today and how that sort of plays out in the policy sector is access to reproductive health care, economic security, and constitutional equality. And so in terms of reproductive health care, access, and it's not just abortion access, which is what we often hear about in the media, or even things like birth control. It's really looking at the whole spectrum of that. Oftentimes, women have different needs throughout their lives, and if we look at different communities and communities of color, those women also have different needs. One of the things that often gets missed in the mainstream media, and I hate to use that term because of who it was sort of promoted by, but often one of the things that gets missed is the fact that we have one of the highest maternal mortality rates in the world. Not just even within Western nations, but in the world. And that actually disproportionately negatively impacts African American women in this country. And it's something that we don't talk about. So when we talk about access to reproductive health care, it's not just access to clinics. It's not keeping those women safe who need to be able to get to those clinics or don't have to take a one-day bus ride and take time off work to get to clinics. It's prenatal care. It's getting mothers the medication that they need for their kids, for their positive pregnancies, making sure they survive those pregnancies when they actually go through labor and give birth. And unfortunately, our system is set up so that women don't have control over how or when they reproduce, and that is a huge issue when it comes to women's equality in our society. That sort of rolls into the next issue that I wanted to talk about, was economic security. If you can't control how it is you have children or when you have children, that often means you have to take time out of the workforce. Not only are over 2/3 of low-income workers in this country women, they're also making minimum wage or sometimes less than minimum wage. The tipped minimum wage in this country is $2.17 an hour. So if you're not making a living wage, that means you don't have the money you need to be able to pay your bills or get your birth control or whatever it is that you need. Now, thankfully, the ACA means that women will hopefully have access to free birth control, but that is a huge problem. Now, when you have families and when you're talking about economic security, if you take time out of the workforce, it's something that you've been talking about all day today, but Social Security means that you're losing those benefits because you've taken time out of the workforce to be a caregiver. There are no caregiver credits, and that's something we need as well. So we see these different impacts as an intergenerational thing. Women across their lives are being affected by our policies that are sexist in nature. That means they have to step out of the workforce, they're in more vulnerable positions, and they're not allowed to flourish in the way that really would impact us so greatly as a society if women had equal and full participation. Another thing that we often talk about when it comes to women and their families is we sort of, and we're getting better about this, but we sort of invisibilize families where partners are the same sex. So lesbians are often left out of the conversation when it comes to reproductive rights and it comes to family security, and certainly before the overturning of, I think it was Section 5 of DOMA, lesbians didn't have rights to each other's property, so they were facing these huge tax bills, which was again putting them in huge economic dire straits. And so that's one of the, the main issues when it comes to economic security, is recognizing that there are women at these different intersections and how that impacts their lives. One of the things that we think at NOW, and a lot of other groups are sort of joining us in this effort, is recognizing that having constitutional equality might be a way to address this. If women were actually in the Constitution, if they had a place, were actually written into the Constitution, we might not see what we see today. We might not be seeing it. And one of the big things with the way that the ERA is currently written is that it doesn't necessarily allow for lesbian women, trans women, or folks who don't prescribe to a certain gender, and also doesn't take into account reproductive rights. Absolutely, access to abortion, and without any sort of limitation on that, must be codified in law in order for women to really be truly free and equal in our society. The Equal Rights Amendment, there are lots of different variations that are floating around out there. NOW supports all of them, but we do want to make sure that all women are equal under the law, just as men are. And of course, as I've been saying, that really kind of falls under the intersections. So hoping to sort of delve into this a little bit more with my fellow panelists. So I'll move on to, thank you.